I have wanted to be a doctor for as long as I can remember. I know this is exactly what they tell you not to say in medical school interviews. You're supposed to be evaluating your future profession objectively, not simply pursuing your childhood dreams. But it's true. I was the toddler telling people in broken sentences that I wanted to be a doctor. My mom loves to show a drawing that I made in kindergarten of myself in a white coat, and I wrote, "I want to be a doctor." So it's true, it was a childhood desire that just continued to grow. Doctor's visits became the highlight of my week. I was never the kid who was scared of shots. Are you kidding me? This little miracle pinch is going to keep me from getting sick? Give me everything you got. So the fascination with the human body just continued to grow. As I said, I was fascinated with how the human body works, how it stays healthy, and this just intensified as I got further into schooling. Biology courses in high school. College brought detailed dissection labs. I spent hours at the dissecting microscope, harvesting tissue for lab projects. It was probably during college that I knew I had to be a surgeon. So, with a more targeted goal, I then entered medical school, and I met Dr. Edward Jaeger. He's the reason I went into ophthalmology. During first-year medical school courses, he would lecture and just blew me away about the visual pathway. So it was him who really opened my eyes to ophthalmology and to wills. I was fortunate to attend Jefferson, now Sidney Kimmel Medical College. And as a Jefferson medical student, I was able to work frequently with the wills doctors and shadow at Wills Eye. And in truth, I fell in love with wills before ophthalmology. As a medical student, Wills was this surreal hospital where all the doctors seemed really genuinely happy, where cutting-edge procedures were being performed routinely, where strong, smart women held major leadership roles, where world-famous Dr. Carol Shields knew me and would part the sea of her observers to make sure that I was able to get a view of the rare exam findings. So as a medical student, I then poured myself into my next goal, not only to be an ophthalmologist, but to match at Wills for my residency. And that's what happened. I spent 3 exciting and intense years training here at Wills with some of the best teachers in the world. As I got deeper into the field of ophthalmology, it became clear how perfect the field was for me. It's a great balance between surgical procedures and one-on-one time spent talking with patients. It's always very heartwarming when I'm performing cataract surgery on a patient and from the OR table they're trying to ask me how my kids are. And of course I then have to gently shush them because I'm performing surgery on them right now and the precision is crucial. I practice comprehensive ophthalmology, and it ranges from dry eye disease to glaucoma to cataracts. The range of conditions I see in a given day can vary significantly. So as a comprehensive ophthalmologist, I am able to get to know patients and their families, perform intricate and precise surgical procedures. I get to screen for and treat vision-threatening and sometimes life-threatening conditions. So as an ophthalmologist, I get to work to give you the best vision possible. But as a Wills Eye ophthalmologist, I get to do all that, but with the best doctors, staff, and technology available anywhere. All of my time outside the hospital and outside of my office is spent, of course, with my family. I have a 4-year-old girl and 10-month-old twins, a boy and a girl. So we take a lot of walks to the park. I have perfected the drawing of the rainbow with clouds and the smiley face sun peeking out. Of course, all with at least one baby in my arms. And I'm very good at playing Anna from Frozen. I've probably been Anna for the better part of the last 2.5 years. So any time outside of work is spent with my beautiful family.